I'm now joined by Congressman Brad Wenstrup, a Republican from Ohio. He's a member of the Ways and Means Subcommittee on Health and also serves as co-chair of the GOP Doctors Caucus. And Alzheimer's is an important legislative priority. Welcome, Congressman.
Pleasure to be with you, and I'm glad I got to hear the good doctor right before me and all the things that she was espousing. I have to say I'm in agreement with her. And I'm in agreement with her, too, on some of the things that she said where Congress doesn't always get it. But we do have enough physicians here on both sides of the aisle that a lot of times we can get our voice heard and try and explain it to our colleagues in Congress.
You know, Congressman, this is all about saving lives and the quality of life. And, you know, we've talked about today a lot of acronyms and innovation, FDA, CMS, and the gears of government. But from a 30,000-foot perspective, where do you think policymakers have made some progress in the fight against Alzheimer's? And where do policymakers need to go?
Well, Alzheimer's and really there's other things like ALS and
Yep.
other diseases and pathologies that exist that I think we're starting to make a difference. In other words, our healthcare system has so much been involved. If you break it, we'll fix it. And yeah, we're pretty good with treatments and innovations and extending life. But how can we improve life? In other words, lifespan as opposed or health span as opposed to lifespan. So how do we keep people healthier longer? And so this message, I think, is getting through to a lot of people across the country. And so Alzheimer's fits right into that, right? If we can find a way to prevent or to slow this disease down and to make people's quality of life better. And you know, this is one of those diseases too, where it's not just the person who gets Alzheimer's that's affected, it's the entire family. It's those that have to quit their job to take care of their loved one because of this decline. And so those types of things are being considered. So what can we do to prevent? You know, a lot of times in Washington, it all comes down to dollars for too many people, and they're not thinking of the lives involved and the human beings involved. But you can even talk about the dollars, because if you can prevent something like Alzheimer's or delay it for years and years, the savings will be tremendous in our total healthcare system. You know, you just look at what we spend per person on Alzheimer's today. Why not take some of that and put it in towards prevention? And so I do get concerned. We definitely want the accelerated pathway to continue and to drive on. We want to get cures to people faster. And we want people to have a higher quality of life and access and affordability. I do get concerned when I see where FDA approves a drug for Alzheimer's and then CMS says, well, we're not going to pay for it. And then going forward, the only way you can get some of these new emerging medications is if you're in a trial. I think that's a problem for us, and I think we have to dig into that as members of Congress.
And what do you think, Congressman, is the answer to that, where you have this disconnect, seemingly, from FDA and CMS, have different jurisdictions, but this has been a weird kind of break between the two agencies?
Yeah, it really is, and not one that you very often see, fortunately, but we're definitely seeing it here. You know, from where I sit, I would like to sit down with the both entities and really discuss. Well, FDA approved it, says it's safe and effective. They did their job. The drug has been through trials, and the science seems to be logical. You're trying to diminish the amyloid production, which seems to be one of the major causes of the eventual dementia. And then ask CMS why it is you would block this. And are they actually looking at the potential savings over 20 years? If it's all about money, are they looking at the savings over 20 years if you can actually prevent someone from needing all the care that goes with Alzheimer's? Look, as doctors said before, we've all seen it in our families. As a physician practicing for over 26 years in private practice, I saw patients decline. I've seen it within my family. And you know, it's obvious when it's starting. Well, the earlier you can check it, find the markers that tell us it may happen, then we can get out there and try to be ahead of this. And I think we need to continue to go in that direction for the good of those that are looking for hope, and for those of us that want to provide hope and to provide care for people. Prevention is phenomenal, and if we can do that, then the next step will be even better, as typically happens in medicine. You get one new drug, you get one new technology, it leads to getting better and better and better. We've always seen that in medicine. Why we don't want to hold this up.
Congressman, we now have an audience question from Paul Kelly. I do want to point out that this question is about legislation, so we thought it would be best directed at you if we can roll the video of Paul asking his question.
Cures 2.0, a bipartisan bill that was introduced earlier this year by Congresswoman Diana DeGette and Congressman Fred Upton, bipartisan legislation to address medical innovation and speed the development of new medicines. I'm wondering if the panelists think there's sufficient authority in the government to do that already, or whether they think that bill is necessary, and what they might think the prospects are for that legislation in this Congress. Thanks.
Well, I appreciate the question. I serve on Ways and Means Committee, and I'm on the Health Subcommittee. I am co-chair of our Doctors Caucus that we have here. And we also have on Ways and Means Committee, Rural and Underserved Healthcare Task Force. One of the things we are trying to drive are policies that goes right in sync with that we can get more cures out faster, get rid of the roadblocks, create more access, cut out the bureaucracy, cut out the red tape. We want to be safe. We understand that. Look, I think Operation Warp Speed was an example of how we can get things done in a timely fashion if we eliminate some of the, not necessarily the red tape, but speed up the process. So all of these things go hand in hand with what we're trying to accomplish, and hopefully we can get enough of our colleagues to understand that we can have safety and we can have rapid development. And we have to make it where it's not impossible. And if you think you're going to innovate and create a new drug, but no one's going to let it come to market, or if you think that you can do all this and then not be reimbursed for it in some way, there's that fine line we have to walk. So we have to be working together on all fronts. And I think that more of that attitude is coming forward in Congress. At least I hope it is, that we can go in that direction. But we're crafting policy exactly in that line today. And we want to hear from stakeholders. We want to hear from people that are out there that are going through waiting for a medication. We want to hear from those that are making new medications. What are the roadblocks? How can we try and improve that and incorporate that into our policy?
Last question, Congressman. As you know, there's a big election coming up in the fall, and the House Democratic majority is very, very slim. A lot of handicappers, independents, say, listen, you look at history, you look at the president's approval process, the House is likely to flip. On health care for the Ways and Means Committee, what would that mean as far as a new direction in policy?
Well, I think you'll see a lot of things come forward that I think we'll get some bipartisan support on. You'd be surprised how many things we do get bipartisan support on Ways and Means Committee. But on the Republican side, we have multiple task forces that we are working on right now so that we have our policies ready to roll out even before an election, but certainly after the election. And so these task forces, we're working on things. I'm on the Healthy Futures Task Force, and I'm chairing the subcommittee on treatments. And again, it comes to accelerating innovation, not stymieing innovation, increasing access and availability and affordability for patients. All of those things have to come together. We want to get care to every American that we possibly can. And we, like I was saying before, improve their quality of life. So I think that's the direction that we're going in. Those are the policies that we're putting together, and we'll be making more of those public in the very near future, actually.
Congressman Wenstrup, a member of the Ways and Means Committee, very powerful committee, and co-chair of the GOP Doctors Caucus. Thank you for joining us.
My pleasure. Thank you for doing this.